All right. Good afternoon. It is Monday at 4 p.m. Today, wearing a mask made by Jack and Peggy Hayes, who are retired Fayette County School administrators. They have made these masks for various teachers, faculty, and others that work in Fayette County. Me being a Fayette County Public School alumni, I really appreciate this mask, even a little personalized for me. Thank you to the Hayes. Thank you to Fayette County Public Schools for doing your part to keep people safe during this pandemic. A lot of information today to get through, so we're going to move pretty quickly, but all important information today. So if we start with our Fast Four for the day, these are just a couple things we're going to go through really quickly. Number one, your flu shot. Get your flu shot. This season, more than ever, we need to ensure that every Kentuckian that can gets that flu shot. We do not want to be dealing with COVID-19 and a widespread flu outbreak this season. And if you get your flu shot, it is less likely that if you develop some type of symptoms that you have the flu and you're concerned about having COVID. We need everybody to do this. This is just another way that you can help us get through this fall. And remember, if you don't get your flu shot, you turn out to have the flu, but people think that you have COVID, it can disrupt a lot of lives around you for at least a period of time until people can figure it out. I got my flu shot last week, as did my wife, my daughter, and my son. They can all tell you it doesn't hurt that much. It's just a quick shot. It is well worth it. Everybody go out and get your flu shot. Number two, vote. Remember, you have to request your absentee ballot by, I believe it is October the 6th. You have to register by October the 5th. You can get your absentee ballot at elect.ky.gov. Now, if you are someone who is overly susceptible to COVID-19, meaning of a certain age or have issues with heart, lung, or kidney disease, significant asthma, make sure that you request that absentee ballot. People have stepped up, Democrats and Republicans, coming to an agreement this year to let you vote safely. So make sure you do it. There is no excuse not to vote this year with one of the various forms. So everybody vote. Second piece of that one, though, is the census. It's not just your duty and your patriotic duty to vote, which it certainly is, but also to fill out the census. We only have a limited number of days left. The amount of federal dollars we're going to get, our share, depends on you filling out the census. We don't fill out the census, it just goes to another state. We don't want to let what should be our dollars go to another state when they are going to be needed the most. It just takes a couple minutes. Fill out your census. All right, third, earlier today, we made some great announcements with some exciting news for Western Kentucky. Thanks to the Delta Regional Authority, we announced more than $4.7 million in grants for 11 projects in Western Kentucky. In total, they'll create 80 jobs, provide workforce training for 433 Kentuckians, and improve the lives of 32,400 families. They include an infrastructure improvement at the Fulton County Industrial Park, broadband upgrades in Henderson and Hopkins County. That'll help out in NTI. It'll also help the economy because so much now is determined by access to broadband. It'll help a primary intake backup generator for the Logan Todd Regional Water Commission, upgrades to the Trigg County Hospital. It's really important in a time of a health pandemic. Land acquisition for a training school in Webster County, an additional dentistry station at the Blount Rural Health Center, improvements to the Powderly Wastewater Treatment Plant in Greenville, the addition of new clear well at the South Water Treatment Plant in Henderson, construction of a hangar at the Madisonville Regional Airport for a training program, and it'll provide software engineering training in Paducah. So even while we are dealing again with this crisis of the present, we are making the investments to make sure every single community can take off when we are out of COVID, create those type of jobs that we really need. Now, as we are fighting this virus, it's important that we keep our spirits up, that we don't get tired, and that we remember that wearing this mask, staying 6 feet apart, following the very best rules and practices is so important. And Mask Up KY is more than a hashtag or a slogan. It's one of the main things that's going to determine how many people die, how few people we can lose. There is no disagreement in the scientific community that wearing a mask will help save somebody else's life, will protect the health of those around us. So we've asked people, get online, show that you can do all these things while still wearing a mask. So first today is from Nikki Webb, and they've got a couple things going on here. One is they are taking a vacation close to home, ensuring that they're not traveling to one of these states that we're not asking people to. This is them at Natural Bridge, and so they got a twofer in this one. They're wearing masks and encouraging the wearing of masks, and also being really responsible in how they get out and how they get away. Natural Bridge is an incredible destination that I'm excited to take my family to here soon. Okay, second one is from Lincoln Trail HD. Again, they wear their masks to protect their family, their friends, and their community. They want to do their part, and this is the assistant principal at Marion County Middle School and a mom. Again, just showing us that we can all have a good time. We can all still enjoy our lives and our families while wearing a mask. Assistant principal, even more important. She's going to be interacting with a lot of kids here very soon, and the amount of people that wear masks when they should will help make sure that's as safe as it can be. All right, the next one, for those of Bernheim Forest and who enjoy it, will really like this. This is one of Bernheim's great attractions that people come to see. Again, just trying to show that spirit that we're going to make it through it. We're all going to wear masks, and that's going to make sure we all make it through it. All right, and this is the last one for today. I think this is pretty neat. This is Patty Miles, who is sending this to my wife, saying she has 120 masks that she's made with some help from a dear friend, ready to donate to the Covering for Kids program. This is the First Lady's program in ensuring that every child going to school will have a mask that fits and that they can wear. We appreciate her wanting to be a part of that program. And of course, I very much appreciate the First Lady for this initiative, for making sure that our kids, our two kids, and everybody else's kids can be safer as they return to school. All right, couple of other major announcements. Number one is today we have applied for the 3 additional weeks of unemployment insurance coverage of the extra $400 for those that qualify. If accepted by the federal government, those that qualify for the additional dollars would receive their $400 extra for the weeks of August 22nd, 29th, and September the 5th. Each week would ultimately be paid separately, but as some may remember, the initial $600 that the federal government had provided for COVID help had expired. We were then able, under an executive order from the president, to apply for an additional $300. We added $100 on top of that from our state COVID funds that we had approved for a 3-week period. This is the next 3 weeks, and we have gone ahead and applied for it. Now, we want to do that to help our people get through it, and we've also seen that these dollars cycle through our economy. People withhold them as they should. It's truly helping to make sure that this recession can hopefully be short-term, and that we can really bounce back. It's helping to save businesses and to stimulate our economy at a time when we need it. I didn't think this was a hard decision, but we do have to look as we go at our finances and just make sure we're at a place we can do it. We can. Next, testing. So you may recall several weeks ago when the CDC came out with some new, strange, contradictory guidance about asymptomatic people who have been exposed not being tested. And us having a very great concern about that, because if you've been in close contact with someone who has tested positive, you ought to get tested. And it was strange that this new guidance came out. We did what I think we're supposed to do. We told you what we really feel, which was that guidance was an error. Well, the CDC has changed its website related to that testing to roll back the controversial changes made last month and stressing once again that anybody who's been in contact with an infected person should be tested for COVID-19. Now, we've been providing this guidance the whole time. I know there were some that said, wait, but the CDC changed their guidance. Listen, we got a good idea now of who should and shouldn't be tested. And if you have been exposed, make sure that you get tested. There's some highlights in that guidance that say, due to the significance of asymptomatic and pre-symptomatic transmission, that you can be asymptomatic or before you have symptoms and still spread the virus, that the guidance further reinforces the need to test asymptomatic persons. It's pretty simple. They think about 40% of all the transmission occurs with people with no symptoms. So the only way you stop that transmission from occurring is if you test somebody, find out that they have the virus even if they're asymptomatic, and make sure they're not out spreading it. And it's not rocket science to say if you want to stop that spread, you got to test those individuals. So what that means is that even if you don't have symptoms, you still need to get a test if you've been in close contact, such as within 6 feet of a person with a coronavirus infection for at least 15 minutes. So this is just using the good judgment we ask people to do. If you've been around someone for significant time in proximity, then get tested, and you should want to get tested too. Bring a little peace of mind to you and your family. Make sure you're not spreading this to other people. I know none of us ever want to be the cause of a spread that harms somebody, so just do the right thing. And there are plenty of places to do it. Can you put up the overall map of testing locations? Kentucky, unlike other states, is still performing significant testing. Over 1.1 million tests done to date, and we are seeing it being pretty consistent in the number of cases and the number of negatives that are coming into us that are reported each day. There is a location everywhere. There are a couple of major drive-through locations. Let's go through them quickly. If we can, James, in Louisville, it's a partnership between the state and the University of Louisville. There are multiple locations. You can call this number or you can go to the website. This is all online. Make sure you continue to use it. There's also the Norton facility in Louisville that's doing 600 plus tests a day. Let's make sure we keep using that too. That is a partnership with the state as well. In this one, we provide the tests. They actually do everything else on their own dime. So that's a really great service that they are providing. In Lexington, we've got a partnership with UK. Let's make sure we're continuing to use that drive-through site. And then in Northern Kentucky, it's St. E's St. Elizabeth has 2 locations. Those are just state-sponsored drive-through locations. There's a ton of other ones out in the state. Make sure you are getting tested. All right, let's talk a little bit about last week before we move into today. Let's show the overall bar chart of weekly cases. Last week, we had our second highest number of cases by week. And as you look at that, I think it's still, it shows if you're looking at overall number of cases that at least since we hit that first big jump, that we have stayed, either relatively stable or small increases in total number of cases. We really want to see this overall number come down. And I'm going to talk about the positivity rate in a minute, which is going the right direction. We want that. Positivity rate going down means we're testing a lot of people. We're finding a lot of asymptomatic people who are positive, and we can stop that spread. And it probably means that there are a lot more people out there, obviously, than this that have the virus, and we're finding more and more of them. But just those overall numbers, even if those are all the cases that we had, they're too high. And we got to do what it takes to have fewer new weekly cases. Because the number of Kentuckians we lose is based on a pretty simple equation. It's the total number of cases times our mortality rate, because that's how you calculate the mortality rate. It's the total number of people who test positive that pass away. So even if it's down, I know it's south of 2%, even if it's at 1%, in a week where we have 4,597 cases, we're still losing, about 46 Kentuckians. And we want to do better. We want to make sure that while we still light up those green lights every night to honor those we've lost, we want to get to a point where we are losing fewer Kentuckians, meaning we're doing more to tamp down this virus. So this is the tough news. It's one that we have to continue to work on. But there is some positive news. You want to go to the positivity rate? We have a bar graph for that as opposed to the line graph. There you go. So this is the positivity rate week by week. So when we start out, we were only testing people who were symptomatic because we didn't have enough tests. We were asking people, if you're not really sick, gut it out at home, talk to your healthcare provider, but don't get tested. So in the beginning, you saw really high positivity rates because we were pretty sure you had COVID if you were getting a test. In fact, if you didn't, if you weren't a positive, it was surprising and a relief at times. But when we got over that initial time when we didn't have enough tests and we started ramping up our testing, what we saw is that as we got into healthy at home, our positivity rate plummeted because people's contacts were negligible or low. And then once we started opening back up, you saw it creeping up and creeping up and creeping up. And that's what happens. If you're out more and you're seeing more people, there's a greater chance that you can get COVID. And also, the longer we went, I think people were getting tired. Some people call it COVID fatigue, and maybe not following the practices as well. The time when we asked for school to be pushed off and in-person classes until September 28th is when we hit 6%. After that initial spike, it's the highest part we saw on this graph. And basically what we said is we need time to push that down, the mask mandate and other restrictions to work. And you see that that is happening with the overall positivity rate. And even today, as we'll talk about it later, we're at 3.77%, which this is one of our longest times under 4% that we've had since we ever went over it. And so what we're seeing here is this shows that we're doing the testing part well. I think it shows that Kentuckians, especially July 5th and afterwards, so we're going to see impacts from Derby and the rest probably coming soon, took it very seriously, and that helps us to get it down. Our challenge in this graph is going to be we'll restart in-person classes in many parts of the state, sports, and the rest. Again, we've just added more contacts on top, more interaction, more chance for the virus to spread. So it's going to be a real challenge for us to keep this positivity rate low, which comes down to all of you, every Kentuckian. Are we going to wear our mask because we want to do these extra things? Are we going to stay 6 feet apart? Are we going to make sure that in the same day, we don't get our hair cut, go to a restaurant, go to a bar, and make sure that we pace ourselves in many ways on the amount of contacts that we have. So total number of cases, I'm certainly not happy with. We want to see a decrease there, but the positivity rate continuing to stay below 4% is a real positive. Going to be hard to keep it there, but that's the work that we have to do. Also want to show the incident rate map. As you all know, we put up an incident rate map last week. It is updated I believe at the end of every day. This is meant to be a tool to our counties and our school districts about choices that they make. There's a key that goes along with it. The map goes from green, which is a really good place, yellow, which says, the cases are are higher than we'd like, to orange, which is a warning that you're about to head to red, which is significant or critical community spread, and actions need to be taken once you're red to get the virus down. If you're green, that's phenomenal. Do everything you can to stay in the green. If you're yellow, just make sure that you are doing the right things. If you are orange, be taking steps to get down to yellow. And if you are red, heed the guidance. It means you got a lot of people in your community and a lot of vulnerable people at that point that are going to be exposed because of the mass community spread. If you are in red, do not try to argue your way out of red. For many in the red, they asked for this tool, and some are now trying to argue their way around it. If you're in red, you have a duty to your community, to do what it takes to get out of that zone. It means you're putting people at risk if you're not following the guidance. And it's not just people in your area or institution, it's everybody throughout the county. Let's be responsible. This gives the information that was requested. Let's make sure we do the right things. Now you'll notice that as of really yesterday, our number of counties in red are significantly less than even they were, I think, about a week ago. But remember, when you hit red, it's not okay to be out of red for just one day. You really need to do and take the steps to make sure that you can get that transmission down. And we need two things as we go forward in fighting COVID. Number one, we need that strength and endurance, knowing that it is going to end. We got to be strong enough to do the right things until it ends. And number two, we need to have flexibility, knowing that this virus can pop up in an area and absolutely take off. And when that happens, we got to be flexible enough to, whether it's in-person learning, to going to virtual, or changing other things, even with our small businesses that may be impacted. And when we hit red and we know that there are major issues, we got to take steps. And to highlight that, I'd like to show, we have a video today from the CEO of King's Daughter in Ashland. Many may have seen that they have been at capacity in their hospital for treating COVID patients. It shows you how quickly this can arise, and she has a message about wearing a mask and doing what it takes.
Hello, my name is Christy Whitlatch, and I'm the CEO of King's Daughters Health System in Ashland, Kentucky. Our health system serves Eastern Kentucky and Southern Ohio. Unfortunately, we have experienced a surge of COVID-19 cases over the last couple of weeks, and have had many days where our hospital has reached capacity. We have both been at capacity from a bed issue, as well as our clinical team's ability to care for COVID-19 patients. Along with the surge of new cases, we are also seeing a surge in the need for inpatient care, as well as increasing mortality. This disease is no longer just affecting the frail, elderly people with underlying health conditions. It is affecting babies, children, and healthy men and women who have no idea how they were exposed. Understand people have differing opinions about this disease, but COVID-19 is real. The recovery is difficult, and some individuals will have their health affected for the rest of their lives. To help stop the surge, I urge everyone to wear a mask, wash your hands, practice social distancing, stay at home as much as possible, and avoid large gatherings. I also ask for your prayers and encouragement to our healthcare workers and all of those affected by COVID-19. Thank you.
Christy is a leader and a warrior. She has done a phenomenal job in dealing with multiple challenges, both before and during COVID-19. So today's report looks a lot like our Mondays, around about the same numbers we see every Monday because the labs, for the most part, are closed on Sundays. We have 406 new positive cases today. 67 of those are kids under 18. So again, we continue to see an increase in that area. Actually, I only have 0 to 19 in front of me, but it looks like that is now 15%. And given the amount of testing that we do there, it shows that either there's been significantly more infection in that age group or it is increasing. Thankfully today we only have one new death to announce. That is a 77-year-old woman from Scott County. But let's remember, even though that's one of the lowest totals that we've had, that her family is going to be missing her. And let's light our homes up green, and let's ring those bells just as much when we lose one individual as more, because we all matter. She matters. And to her community, it matters. And it ought to matter to all of us. Our positivity rate, 3.77%. Total number of tests, at least 1,131,075. 474 Kentuckians hospitalized for COVID-19, 108 in the ICU, 64 on a ventilator. Long-term care update, 27 new residents testing positive, 45 new staff, 11 new deaths attributable to long-term care residents. That is since, I believe, our last reporting, or since Saturday's reporting. In fact, I think we've just done updates. 4 new facilities have had at least one positive case. Since last Thursday, big jump in Kentucky child care facilities. 19 new facilities with at least one positive case, including 17 staff members and 7 children. You know, this is one of the reasons that we want to be so careful in our schools. I mean, it shows you that children coming in, spreading it to adults, and vice versa. We got to make sure that it's not just our kids we're protecting, but also our daycare workers, our teachers, and others. K through 12 schools, thankfully this is a very small increase, though. We know more are coming based on some events that we learned about today. 3 new students, 5 new faculty or staff, 2 new schools have had at least one case associated with them. Colleges and universities, we continue to see a lot of our students testing positive. 121 new positive cases since Friday. 4 new colleges or universities with at least one case. All right, right before we turn to questions, let me first say happy birthday to my dad, Steve Beshear. I love you. It's a special day. Happy birthday. All right, we'll move in. We got a full house here. I just have a couple of questions here. I think I started Thursday on the left, so Lawrence, we'll start with you on the right, though we are split by gender today. Then I'm going to start over here.
Now that we are just a week out from your original recommendation of getting back to in-person classes and looking at that map that you showed, do you think Kentucky is in a place to have a majority of school districts have in-person classes?
Yeah, so the question is, do we believe that we are in a place for a majority of school districts to have in-person classes? If we look at the map, if you can pull it back up again, I believe the answer is yes, in some form or fashion. So if I am one of the orange counties, I am probably looking at a hybrid model, smaller pods, maybe continuing to do virtual learning, but bringing kids in a little bit more. Maybe it's a couple hours a day, a few times a week, but an experience that is more than now. If I am in the yellow, I'm probably looking at a hybrid model and or spreading kids out more and more. If I'm in green, the answer to that is yes, but I'm still following every single practice, masks all day, and spreading out. So I think if you look at this map, yes, we are ready for the majority of districts to be in, but there are some districts that have extra challenges that are hard to just judge by the map. Those largest districts that have transportation issues too, it just adds another layer on, especially when you look at busing. So I think we need to be understanding of districts that might not be in red, and some might not even be in orange, but are still going to wait a little bit longer to go to in-person classes. Shelby?
Following some vandalism at a COVID testing site in Lexington, there's been a lot of talk about false positives and how often that happens. Can you address how often the state sees false positives and even false negative tests?
The question is on on false positives or on false negatives. When you have 1,100,000+ thousands of tests, they're not all, you are not going to have 100% accuracy. And when you have them across different systems, those original Abbott rapid tests, we had real concerns early on about their accuracy, and so we used them less. Now, when you have this many tests, just like in anything else, you are going to have some false positives or some false negatives, but we believe that number is very low. By and large, we believe the testing is very, very accurate, especially the PCR tests in the nose. Now, the less invasive the test, sometimes the more concern that we have, are you going to get a good sample? And there's always room for human error, either on the administration of it or on the lab work on it, or possibly on the input on it too. And we got to understand these are hardworking humans that are doing their best, but we believe that the data, because there's so much of it, is very, very accurate. That doesn't mean there's not going to be one or two. We never want that to happen, but we believe in the numbers. Joe.
Has there been any further discussion between your office and Attorney General Payne and Chamber's office on the timing of this decision of the Taylor case?
The question is has there been more discussion between our office and the AG's office on the timing of a decision on the Breonna Taylor case? I'm not in a position to share information on that topic today.
Governor, you did that one so quickly.
I can go to the other Joe for 1 minute.
No, I'm good. We had a large number of new cases. I guess it was Saturday. We had over 1,000.
Yeah.
Is this now the fallout from Labor Day weekend activities?
So the question is, especially based on Saturday, where we had our second highest number of positive cases ever, is this fallout from Labor Day or the rest? It's going to take us a little while to know. Can you put up the purple map again? Because it's not that far out of where we've been. If you look at the week before, that it could always be spillover. If you look at the week before that, it's just we're probably going to need to be a week or two down the road where we can attribute it. I will say, as opposed to the 4th of July, we heard about fewer big Labor Day gatherings or Derby gatherings. We do think it'll have an impact, but I think the bigger impact is, do people get tired and stop wearing the masks? That's it. It's how strong are we? What's our endurance? How tenacious are we? Are we willing to fight this thing for as long as it takes? And there have been days that I don't think I ever realized are kind of ingrained into our psyche, like the start of summer. And we feel a little bit differently on it. And I do think it factors into our fatigue or our willingness to do different things. And I think we hit another one of those in August. My hope is that we bounce back just like we did after the summer. Do I have a comment on the lawsuit filed this morning on behalf of David McAtee? Given that is in litigation against the National Guard, we don't have a comment on it at this time. Joe. The question is, are we taking any extra precautions at the Capitol, or have we authorized the National Guard? Again, I don't have any information today to share on any timing on a decision. I will say that National Guard assistance has previously been requested for an if and when, and our response has been that if needed, the Guard and the Kentucky State Police would engage in limited, specific missions where they would be under their own command, that would be in support of LMPD, and that would be the role that we would play if needed. And if it is needed, we will authorize it.
Expand on that. What would be the role of the National Guard if they were to put a role in advance of this
So if the National Guard is deployed to Louisville, their missions would be limited, specific, in support of LMPD and in protection of critical infrastructure. But outside of that, we're not going to comment on their mission for the safety of those National Guard members. Is Kentucky seeing any signs of community spread, especially increased hospitalizations from college campuses reopening? If so, where are we seeing those results? I actually believe the best person to talk about that would be Linda Gorton, the mayor of Lexington and their public health lead. They're certainly seeing spread amongst the college students. And there's no way that that spread stays just within the college students. Hospitalization, we'd have to check, though. I'm not sure that we have seen the increase there. I think that we've, again, got to think about some of the guidance that we are giving with relation to our universities. I do worry that we are asking more from our college students than it can be reasonably expected. If you're quarantined as a 18, 19, 20, 21-year-old, can you be reasonably expected to stay there and not go out at that point in your life when you're in or around a college campus? We've really got to think not just about do we send somebody home and possibly spread it to their community, but do we send them home where hopefully mom or dad or whoever cares for them potentially could keep that spread from the community? There's no easy answer there, but I think we need to be very thoughtful moving forward with the number of cases we're seeing.
Bird and do you believe there should be a vote on a Supreme Court nominee before this upcoming election?
The question is my thoughts on the passing of Justice Ginsburg, and then comments on whether I think that there should be a vote before the next election. So my first profession was mucking stalls. My first profession outside of college and law school was as a lawyer. And Justice Ginsburg, just a titan in not just her accomplishment. I mean, you got to the U.S. Supreme Court. How rare is that for anyone who has ever lived since the birth of our country? It is thankfully not a fraternity, but it is a group, a very small group that. It's an incredible accomplishment, but her intellect. Second to no one that's ever served on the court. I think you could compare her writing and analysis with others, but I think it is right up there with the very smartest, most talented people that have ever served on the court. As the father of a 9-year-old girl, oh my goodness, it shows the possibilities that are out there, and it shows that our strength is not dictated by our stature. What a powerhouse. I believe that someone of that stature, I believe anyone, deserves to be grieved for a couple of days before people start playing a political game or trying to figure out what's in the will. And in many ways, I think that what's going on right now kind of feels like that. Kind of feels like that amazing family member passed away and people immediately started grabbing for the will to see what's in it and arguing about it. I also believe that our word has to still mean something. And that if you make a promise during one period of time that if something happens 4 years later, you'll do the same thing, you ought to keep your word. Otherwise, how do you negotiate? How do you sit down and get things done in Congress or anywhere else? I believe what they did in 2016, you should do in 2020. It shouldn't just change because this group or that group gets to pick. And for me, that's less about ideology than, if you look at a camera and you say, I will do this if the situation arises again, you ought to keep your word. I mean, that's our bond. That's what should make people trust us. That is a good question. We have Secretary Freelander here, and I realized he had one other update if you want to give it here real quick that I forgot about, wanting to wish my dad happy birthday and get into questions.
Thank you for the question. We have had a couple of applications, I think about 4. They've not gone all the way through the process yet because it's a contracting process, but it has begun. So we've taken those applications. We have a group of individuals that review those applications, and we hope to be making awards soon. Thank you for asking that question. It actually has begun. The announcement today has very quickly to do with long-term care. We are using the exact same incident map that we're using for schools. And with long-term care, the way we're going to do that is beginning September 24th. So that's personal cares, intermediate care facilities, other long-term care facilities. The frequency of testing is going to be based on the county and incidents in those counties. So yellow and green counties, every 2 weeks, twice a month. The orange counties, we're asking for them to be tested weekly, and the red counties will be asking for those counties to be tested, those facilities in those counties to be tested twice a week. Just like schools, they'll look once a week at a specific time, and that's how they'll determine the testing for the next week. We continue to support long-term care facilities with our testing program. Some of the long-term care facilities in Kentucky have received those point-of-care testing equipment pieces. They can use those as well and use those in conjunction with the testing piece that we have. The other big piece that we're announcing today is some slight, I think, changes in accordance with the CMS, which is the federal group that controls this, but Kentucky-specific guidelines for visitation. There have been very few allowances for visitation in the state. It has been very, very difficult for families and residents. And believe me, I understand that. So after working with this, after these months where we had a very quick response, an early response, we end up in about the 20s for incidents. We've actually done a little better in terms of death rates in our facilities. We feel like it's time, and in accordance with CMS, to loosen up just a little bit on the visitation standards. So instead of a facility being free for 28 days, again, in accordance with those federal standards, they need to be free of a new case for 14 days. Again, an individual can go back in at that point. We want them to be masked. We want the temperature taken. The facilities can even use their point of service testing equipment if they like. So we then are going to allow a little bit of communal dining as long as the distance, the 6-foot distance is maintained, that social distancing. So we're going to allow a little bit more of that testing. And our expectations are, folks have to go in, they're going to wash their hands, they're going to wear their mask, they're going to stay at least 6 feet from the closest person. All those infection control precautions will need to be in place. The cleaning and disinfection, everybody using the personal protective equipment. And we're going to allow then, we announced last time that you can use what's called a civil monetary penalty. You apply to the Office of Inspector General, the Kentucky Office of the Inspector General. We've allowed facilities to apply for iPads, tablets, so that you can do some of that virtual communication. We're also going to allow them to apply for things like tents and plexiglass and other ways that they may be able to set up visitation outside, and we hope and encourage long-term care facilities will apply for that funding. The other piece that's unique to Kentucky is that we are going to allow an individual, if they have a pet, a cat, a dog, a beloved pet, that individual that's going in to visit, if there's a pet, one pet, not the pet therapy where they go around and become the honeybees, but that person's pet in the facility, you can bring that pet in to visit, again, according to facility guidelines, but there's little to no indication that there's any transmission that happens there. Very, very, very rare. And sometimes those pets, we all know, can really make somebody's day. So that's the piece that's unique to Kentucky, and I hope that we will find that perhaps we will help some individuals who have been in long-term care facilities for a while, whose families are very interested in getting in, and so we're providing some new guidance, a little more flexibility for our long-term care partners. Thank you. Make sure I get that right.
The question is on the command structure. Should the National Guard be deployed? If the National Guard is deployed, they will be under the command structure of the National Guard, with commanders present and at a center in or around Louisville. That was actually the same as Derby, where that chain of command was there. It does not go through LMPD. Same with the Kentucky State Police.
Governor, you mentioned a couple weeks ago that you were having physical taken. I wonder how that came out.
Yeah, I did have my physical a couple weeks ago. I'm in good shape. I think they think there are a few things that I could maybe do a little bit better. But I was pleased that even in the midst of all of this, physically still doing just fine. Healthy family too. I've been pretty blessed that stress doesn't have a major physical impact on me. But I will say that we got to understand that it can, especially during COVID. I mean, I've noticed whether it's allergies or a little bit of asthma that can be, exacerbated a little bit with everything that's going on. And I mention that so I hope other people take care of themselves and see their doctor and get your flu shot. The question is, how concerned am I about seeing unrest if and when General Cameron makes his decision? I think so much depends on how Kentuckians are communicated with, what facts are shared, what process is shared, what information is put out there for people to absorb and process. My concern all along has been that if an announcement is just made in a vacuum of that information, people don't have a way to process it other than maybe how they feel or what they saw on TV. So I hope whenever any announcement is made that there is a lot of context and a lot of facts that are put out there. My hope is that any type of, and we call it unrest, but any type of demonstration is one that is peaceful. That doesn't mean that it's quiet. It doesn't mean that people don't give voice to frustration or what they want to say, but ultimately is done in a way that certainly would move discussions forward, but not cause some of the damage that we saw earlier.
Clarifications. Previously, we've been asked about communication with the Attorney General's office over this case. You said yes or no. Maybe infer from your last answer that you have been in communication, but you can't talk about it.
It's fair to say that we have been generally in communication with the Attorney General's office, but we can't share those communications, and I don't have any comment on those communications today, and you can't infer anything from it because I'm not commenting on it any further.
And second, have you or have you not been asked to deploy the National Guard at this point?
I believe that we received a week ago just a general request that had to do with the National Guard. I have not deployed the National Guard as we stand here today. Okay, everybody. Again, cases too high, positivity rate coming down. We all have a part to play to defeat COVID-19 and to defeat every other injustice that we are facing as a society. Let's make sure that we do our part. Let's also make sure with this new tool, this incident map, that we realize that COVID can increase in our community and it can decrease. And that there are going to be times over the next several months where it's safe to do something, but several weeks later it may be unsafe to do it. Let's understand that that's based on more information that we have and ought to let us do more and do more safely. But let's not fight against the tools we put out. Let's use them to make good decisions. All right, we will be back tomorrow at 4 p.m. Thank you to everybody out there working hard. And we should, by the end of this week, have Halloween guidance out there for everybody. Want to make sure the kids can still have a good experience. It might have to be a little different. It should be a little different. But remember, for adults, big Halloween parties are something that we absolutely can't do. And let's be responsible enough in the middle of a pandemic to focus on trying to get a good experience for the kids and understanding that we can take one different Halloween. Thank you all very much. Thank you, Virginia.